This person is always smiling. Life must be good, because he's always so happy. At least that is what we think. But this could also be the face of someone with depression. The point is, some people are just good at concealing their depression by putting on a happy mask. Others may even appear exponentially outbid. Most people with depression don't share their feelings for fear of the social stigma surrounding their condition. Some may think that nobody really cares, while others tend not to acknowledge the severity of their depressive feelings. So they may pretend to be fine and hope for the condition to go away. More often than not, it causes them to sink further. It is important to differentiate between clinical depression from the usual mood fluctuations in response to challenges in our everyday life. It is normal for us to feel down in bad circumstances, but this feeling generally goes away when situations change for the better. Clinical depression is different. The depressive feelings typically last for at least 2 weeks, causing you to lose interest in your daily activities and personal relationships. You may be affected by feelings of worthlessness or excessive guilt, sleeping too little or too much, restlessness, or feeling slowed down, poor concentration, or recurring thoughts of suicide. The thing is, we still don't fully understand depression. The major cause of depression is thought to be the imbalances of neurochemicals in the brain circuits involved in maintaining mood stability. Depression is also said to be triggered by changes in the balance of hormones. The most well-known example would be depression among women following childbirth. This can also be compounded by life events such as trauma or any set situations. Depression can happen at any age, but it often begins in the teens or the early 20s or 30s. Women are at higher risk than men of having depression. This is perhaps due to biological, hormonal, and psychosocial factors that are unique to women. In men, depression may manifest in the form of anger, frustration, and recklessness. Some may become abusive. A child with depression may pretend to be sick, refuse to go to school, or become particularly clingy to a parent. Most chronic mood disorders such as depression begin as high levels of anxiety in children. Teens with depression may also experience eating disorders. They may be at higher risk for suicide. For those with depression, opening up to a trusted friend or relative is an important part of coping with depression. Cry when you need to, and reach out even if it feels terrifying to do so. Don't suffer in silence. It's not easy to just snap out of clinical depression. Most people may need help to get better. If you are dealing with someone with depression, please show them that you sincerely care and are ready to listen. Tell them you believe in them even if they themselves don't. An open conversation about depression can help to do away with social stigma and make it easier for depressed people to seek help. However, don't tell depressed people to think positively and avoid comparing clinical depression with your normal temporary feeling of sadness. This may sound dismissive and can make them feel guilty for struggling. Assure them that depression is not a sign of weakness or a character flaw. Advise them to seek professional help. With proper treatment, depression is treatable and manageable.